If you have fibromyalgia, a normal test result is not a surprise. It is what the condition predicts. The problem is in how pain is processed, not in a damaged joint waiting to be found on a scan. Let me explain what that means, because it changes how you should read your own test results. Fibromyalgia is a long-lasting disorder that causes pain and tenderness throughout the body, along with fatigue and trouble sleeping. The single most useful thing to understand about it is the mechanism. People with fibromyalgia have an increased sensitivity to pain. They feel pain when others do not. The cause is not known. That is worth saying plainly, because you will hear confident explanations from a lot of places. What the research has established is narrower than a cause. Brain imaging studies and other research have uncovered evidence of altered signaling in the neural pathways that transmit and receive pain in people with fibromyalgia. Those same changes may also contribute to the fatigue, the sleep problems, and the cognitive symptoms. That is how the evidence reads, and I am not going to upgrade it. Now, hold that next to the experience most people describe. You go for imaging. The imaging is clean. Someone tells you the results are normal, and you leave feeling as though you have been told the pain is not real. But if the amplification is happening in pain signaling pathways, then a clear X-ray is exactly what you would expect. It is not evidence against your symptoms. It is a picture of a structure that was never the problem. So what does the condition actually look like? The main symptoms are chronic, widespread pain, either throughout the body or in multiple areas. Often the arms, the legs, the head, the chest, the abdomen, the back, and the buttocks. People describe it as aching, burning, or throbbing. Alongside that pain sits fatigue and trouble sleeping. Other symptoms may include muscle and joint stiffness, tenderness to touch, numbness or tingling in the arms and legs, problems with concentration, clear thinking and memory, sometimes called fibrofog, increased sensitivity to light, to noise, to odors, and to temperature, and digestive issues such as bloating or constipation. That is a long list, but look at what is on it. Sensitivity to light, noise, odor, and temperature sitting right alongside pain is consistent with a nervous system that is amplifying sensory input generally. It is not a series of unrelated complaints. Presented one at a time to different clinicians, those symptoms invite separate referrals. Presented together, they form a recognizable pattern. Who develops it? Anyone can. More women than men are affected. It can occur at any age, including in children, though it usually starts in middle age, and the chance of having it increases with age. It occurs in people of all racial and ethnic backgrounds. So if you are a man, or you are 22, or you are 70, none of that rules it out. There is one more group worth naming. People who have other diseases, especially rheumatic diseases, mood disorders, or other conditions that cause pain, may be more likely to have fibromyalgia. I want you to read that the right way. That overlap is a reason to evaluate, not a reason to assume one diagnosis excludes another. Having a known rheumatic diagnosis does not mean widespread pain has already been explained. How is it managed? Treatment typically involves a combination of exercise or other movement therapies, psychological and behavioral therapy, and medications. 3 components. No single element carries it. And notice that the behavioral component is not an add-on tacked to the end. It is one of the 3 named parts of standard management. At this practice, that behavioral work is delivered in-house rather than referred out. Counseling for chronic pain and the relationship between anxiety, post-traumatic stress, and chronic pain are both described on our pain treatments pages. Where a specific pain generator coexists with widespread sensitivity, that generator is still worth identifying and treating on its own terms. Our range of pain treatments covers those options, and lifestyle medicine addresses the metabolic and activity side. 2 questions come up constantly, so let me answer them directly. First, all my tests came back normal. Does that mean nothing is wrong? No. Fibromyalgia involves increased sensitivity to pain and altered signaling in the pathways that transmit and receive it. Normal structural imaging is expected, not contradictory. Second, is fibrofog a real symptom? Yes. Problems with concentration, clear thinking, and memory are recognized symptoms of the condition. And research suggests the same altered pain signaling may contribute to them along with the fatigue and the sleep trouble. Cognitive assessment is available here. If you have widespread pain that has not been explained, or you've been told your tests are normal and left it there, that is worth an evaluation. Seek urgent assessment or call 911 for sudden severe headache, unlike any you have had before. Chest pain, pressure, or pain spreading to the arm or jaw, with or without shortness of breath. New weakness, numbness, or drooping on one side of the face or body, or sudden trouble speaking, loss of bladder or bowel control, or numbness in the groin or inner thighs with back pain, fever with severe back pain, or pain with a hot, swollen red joint. New pain after a fall, crash, or other significant injury. Pain with unexplained weight loss or night sweats. Thoughts of harming yourself. You can request an appointment at painmd.tv/appointment, call 314-481-5000, or text 314-886-5902. We have 2 locations, 4477 Woodson Road, Suite 100 in Street Lewis, and 12174 Natural Bridge Road in Bridgeton. You do not need a referral, and you do not need to be an existing patient.